Myself, Prabu, lecturer, E.S College of Nursing, Villupuram. Now I discuss the topic glucose tolerance test. Glucose tolerance test. A glucose tolerance test measures how well body uses sugar. It commonly used to diagnose diabetes, including gestational diabetes, including gestational diabetes to assess conditions like insulin resistance. The test involves drinking a glucose solution and having blood sample drawn at intervals to monitor how the body processes the glucose. First one, oral GTT. 50 gram of glucose is weighed and given to the patient irrespective of the time of the last meal. A blood sample is taken and the postprandial blood glucose level is tested. If the level is higher than 140 mg by deciliter, then further testing done. In this step, the blood glucose levels are measured before ingestion of 100 gram of glucose. Then 1 hour after ingestion of glucose solution, 2 hours later after ingestion, and finally 3 hours after ingestion of the glucose solution. Next, mini or modern GTT. As per current WHO recommendation is the mini or modern GTT. Only 2 samples are collected. Fasting 0 hours and 2 hours post glucose load. Urine sample are also collected during the same time. The diagnosis is made from variation observed in this result. Then next, extended GTT. An extended GTT may be conducted to detect cases of reactive hypoglycemia or other abnormality of glucose metabolism with samples taken at 0 hours, 0 minutes, 30 minutes, 60 minutes, 90 minutes, 120 minutes, 150 minutes, 180 minutes. The extended test may also be used to diagnose acromegaly when samples are also taken for growth hormone level. The next, intravenous GTT. Intravenous GTT is often used for persons with malabsorptive disorder or previous gastric intestinal surgery. Glucose is administered intravenously over 30 minutes using 20% glucose solution. A glucose load of patient 0.0 gram kg of body weight. Next, types of curve. 3 types of GTT curves. First one, a normal GTC curve, decreased GTC, increased GTC. First, normal GTC. Normal response to glucose load is as follows. Initial fasting glucose within the normal fasting limits 70 to 100 mg. Blood glucose level rises peak 120 to 140 mg percentage at half an hour to 1 hour after injection at glucose. The blood glucose level then returns 55 mg rapidly to the fasting normal limits in above is 2 hours. Decreased GTC. It means decreased ability of body to utilize glucose. Fasting glucose is higher than normal limits. The blood glucose level rises about 180 mg 100 ml renal threshold value after ingestion of glucose. The blood glucose remains high for a longer time and may not return to fasting level even after 3 hours. The urine sample corresponding to blood glucose level over 180 mg by 100 ml show urine Benedict test positive. Decreased glucose tolerance occurs in diabetes mellitus and certain endocrine disorders like hypothyroidism, hypopituitarism, hyperadrenalism. Next, increased GTC. It means increased ability of the body utilize glucose. Fasting glucose is lower than normal. Only small rise in blood glucose level be observed even after glucose administration. A flatter type of curve is obtained. No appearance of glucose in urine. This type of curve is obtained in endocrine hypoactivity like hypothyroidism, hypoadrenalism, hypopituitarism. Clinical significance. GTT is not necessary is symptomatic or in known case of diabetic patient. In such cases, determination of fasting or postprandial glucose is sufficient for the diagnosis. GTT is most important in the investigation of a symptomatic hyperglycemia or glycosuria such as renal glycosuria and alimentary glycosuria. These tests make you useful information in some case of endocrine dysfunction. It is also helpful in recognition milder cases of diabetes. Lag curve is resulting in hypoglycemia. Thank you.